Thank you, Mr. Speaker. Honourable Senators, women in Canada wait longer, are diagnosed later, and are too often dismissed or disbelieved when they seek care. Not because we lack compassion or clinical skill, but because our system was never deliberately designed with women's health at its centre. Bill S-243, the National Framework for Women's Health in Canada Act, is our opportunity to change that. This bill, being brought forward by Senator Henkel, does something both creative and transformative, and I'd like to thank Senator Henkel for taking this wonderful initiative. This bill does not create a new program, it does not intrude on provincial jurisdiction, and it does not medicalize women's lives. Instead, it asks one clear thing of the federal government: to lead the development of a coherent national framework for women's health in collaboration with the provinces and territories, Indigenous peoples, health professionals, researchers, and community organizations. In other words, it creates coordination, not duplication, and accountability where today there is fragmentation and silence. For decades, women's health policy has been a patchwork of projects, pilot programs, and well-intentioned announcements without a durable plan to guide investment, data, research, and service delivery across the country. The consequences are visible in every region. Women in rural and remote communities travel hours for basic care. Women in equity-deserving groups, including Indigenous, racialized, and 2S LGBTQI+ people, face multiple barriers, and women without regular primary care are left to cycle through emergency rooms with preventable conditions. When half the population is navigating a system that does not consistently see or serve them, that is not a series of individual stories, that is a system's failure. Bill S-243 responds to that failure with the clear, structured approach built on 4 pillars: understanding, preventing, training, and coordinating. It requires the Minister of Health within 1 year to develop a national framework that strengthens research and innovation on women's health, improves primary and preventative care across all ages and life stages, enhances training for healthcare professionals, and targets access gaps for those who face the greatest barriers. Colleagues, it also obliges the federal government to convene at least one national conference in developing the framework, followed by recurring conferences every 3 years, and to report regularly to Parliament on that progress. This is not a symbolic gesture. It is a cycle of monitoring, evaluation, and public accountability. As a family physician, I have seen how the absence of such a framework plays out in exam rooms and hospital corridors. A woman with debilitating endometriosis told for years that her pain was normal. A newcomer juggling 2 jobs who skips follow-up appointments because there is no childcare and no primary care provider who understands her context. A senior in a rural community whose cardiac symptoms are misinterpreted because they do not fit the classic male pattern taught in textbooks. These stories are not outliers, colleagues. They are the predictable result of a system that has not invested adequately in women-specific research, training, or access. Critically, this bill also recognizes that women's health is not just a health issue. It is both an economic and social imperative. Healthier women participate more fully in the labor force, care for families and communities, and drive innovation and entrepreneurship, including in women-led health businesses. By fostering collaboration between public systems and the private sector, and by creating clearer pathways for women's health research and commercialization, the framework can support both better outcomes and a more productive, innovative Canada. Colleagues, some may worry that this legislation will add bureaucracy or burden to already stretched providers. The sponsor and experts have been clear. The goal is not more paperwork, but smarter structure. By asking where the money is going, how it is being used, and where gaps and duplications lie, the framework can help us use existing and future investments more effectively. The risk of inaction is not the absence of process. It is the continuation of uncoordinated efforts that fail to move the dial for the women we serve. The bill is also grounded in listening. It is informed by the work of the Women's Health Coalition and Women's Health Collective Canada, as well as many advocates, clinicians, researchers, and community organizations that have pressed for a national approach. Many women have written to us describing unbearable pain, delayed diagnoses, and a profound sense of abandonment by a system that was supposed to help them. Supporting this bill is a way of saying to them, we see you, we hear you, and we are prepared to act with you. Honourable Senators, the status quo is untenable. Bill S-243 does not pretend to solve every problem in women's health, but it creates conditions to do better, fairer, more evidence-based, and more accountable care. Colleagues, I urge you to support this legislation and to send it promptly to committee so that we can refine it where needed, hear from Canadians, and move swiftly towards a national framework that finally reflects women's health as the priority it has always deserved to be. Thank you. Merci. Miigwech.